Cwestiwn 7, James Evans.
Diolch, Llywydd. How is the Welsh Government improving access to healthcare in Brycheiniog Tywi Nedd?
The Cabinet Minister for Health and Care set out priorities for healthcare in Wales, including Brycheiniog Tywi Nedd, in his oral statement on the 2nd of June. These focus on improving access, strengthening local services, providing more care closer to home, reducing waiting time, supporting staff and ensuring long-term sustainability. We're also considering patient experience of cross-border healthcare as part of ongoing work.
Thank the First Minister for your answer. You mentioned there about cross-border healthcare. You've announced 140 million to address waiting lists, but the previous Welsh Government brought forward 120 million to address waiting lists, and only 115,000 of that ended up in Powys Teaching Health Board, which was 0.1% of the overall funding allocation. So I want some sort of assurance from you today that Powys Teaching Health Board will receive more than what it did last time, so we can actually address the cross-border issue. As you know, my constituents are forced to have their care delayed in England due to decisions that the Health Board take to actually balance their budget. So I'd like to hear from you today that more money will be going to Powys Teaching Health Board so my constituents do not have to wait longer for healthcare when there is capacity over the border in England.
I'm going to throw it back at the member if I can and suggest that what his constituents want is better outcomes rather than more money. Now, it may be that it's about that money. Well, he doesn't seem convinced about that. I can assure you that it's better outcomes that his constituents would want, because that is always what we should assure. Already the government has made significant investment in the first major stage of creating sustainability within health and care in Wales. That very much includes patients in Powys that we know from debates here in the Senedd in recent months and years feel somehow they haven't had a good deal. Yeah, but my minister's focus will be as much on the people of Powys as anywhere else, and it will always be focused on outcomes. A number of members have raised today the question of what we get for money. It is better healthcare that we seek. It's not the bottom line financially, it's the bottom line in terms of people's health, and that is very, very important to people.